A few weeks ago, I had coffee with an osteopathic doctor, and she was telling about one of the studies that she did in her doctorate program. Basically, what she was trying to determine was whether her focusing on a patient's symptoms or her focusing on the opportunities for that patient to get better could affect the symptoms and the outcomes of the patient. She wanted to see if her focusing on the client getting better could actually improve that patient's outlook. So basically what she did was a study, okay? And there were 4 test groups in this study. And basically what she did is she had these 4 test groups separated, and they were all to fill out an intake form. Intake forms are naturally focused on the symptom, right? What are your symptoms? How long have you had them? When are they worse? When are they a little bit better? And you focus kind of on the symptoms. So she wanted to test the symptoms of the patient before they filled out the intake form, and then after they filled out the intake form to see if they got better or worse. And she threw in a couple variations as well. So in the first study, she had the client fill out the intake form. She took the intake form, she didn't read it, she just threw it right in the garbage, and then she went back in and tested the symptoms of the patient again. And the symptoms actually got worse from the patient simply filling out the intake form and focusing on the problems that they were having. Okay, second group. She went in, had the patient fill out the intake form after she tested them, of course, and then she took the intake form, went into her office, and she read the intake form. So she became aware of the issues that the patient was having. She went back in and did the testing again. This patient was actually worse off than the first group, because in this group, the doctor actually knew about the symptoms, and then there were 2 people focusing on the symptoms, which magnified them and made them even worse. Okay, third group. She went in and sat down with the patients and reviewed the symptoms in the intake form. So she reviewed all the problems they were having, how long they've been persistent, and then she tested them again. This patient was the worst off because not only were both of them focused on the problems, but they were really digging deep into them, prying into the information about the symptoms and the problems. Okay, and then the last group, what she did is she went down and sat with them and asked them more about the opportunities, what they wanted to get out of it, what they thought was possible for their health. And this group was actually the best off. Their symptoms had actually improved just by talking about what was possible for them, what they were hoping to achieve. I really thought this was a great study because it shows in life that we have the potential to actually improve people's kind of outlook and the way they behave. And it's simply by paying attention to the things that we really like and adore in them. Because if we pay attention to the problems, it might magnify those in that person. But if we pay attention to what's possible in that person, it may magnify the opportunities that that person sees in their life. So we actually have a lot of control just by the attention that we use.